Hello, my name is Dr. Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 28th of October. And the basic message is that our numbers have continued to increase in terms of COVID, so that today we are showing 196 COVID positive patients in the hospital. That's compared to a figure of 177 which I reported last week. So we've got 128 patients in our general beds on the Blackpool Victoria site. We've got 50 patients in our beds at Clifton Hospital who are COVID positive, and we've got 18 patients who are COVID positive in our intensive care high dependency unit. In fact, because we record COVID positivity as within 14 days of the first positive swab, we have more than 18 patients in our HDU, our high dependency unit. Some of them have come off the 14-day period, but it just shows how very poorly some of our patients are. And I'm sorry to say we've reported an additional 21 new deaths in the last week since we last spoke. So that gives a sense of just how serious the situation is for the hospital and for the community at the moment. When we look at the community figures, which, as you know, I picked from the BBC website, this shows today Blackpool at 431 positives per 100,000 compared to 399 last week. Wire at 367 compared to 298, and Fylde at 340 compared to 270. So this is still a picture of progressive increase in the prevalence of COVID, and that is being reflected on the case mix that we're seeing coming through the hospital. And the pressure is such now that I'm really sorry to say we are having to start to cancel certain outpatient clinics and certain surgical procedures, and we really do not like to do this, so we're doing this as a last resort and trying very hard to communicate with our patients, with the general public, when we do have to change plans. We really apologise for this. It's a last resort for us, but the situation is quite tight at the moment in terms of managing bed capacity and also moving our clinical teams around to be able to do the work that's of most value. What we're seeing too, of course, is that our emergency department is really very, very busy, and I often make this plea to everybody about thinking carefully about how you access emergency services. If something really is an emergency, then of course that's what our ED department is for, but there are many other ways to access the system, and colleagues have been talking a lot about mental health issues recently, and we're all acknowledging that COVID is having an impact on pretty much everybody's mental health. So there are lots of ways to reach into the health service for support in that regard, and of course our GP surgeries are all available for contact if you feel you are struggling in any way. As far as accessing emergency departments, NHS 111, and of course there's the NHS 111 First service, which is taking detailed triage information, detailed clinical information, and offering advice about where best to be seen, and that's available both by telephone and of course online. So finally, a reiteration of really how tight things are from a health service perspective, and we are continuing to escalate our response. We remain wedded to the standard advice about hands, face and space. The very fundamental issues around protecting ourselves and protecting others are so important, and we all need to keep vigilant in that regard. So thank you very much for sticking with it, and I'll update you same time next week. Thank you.